In this presentation, I will be talking about how do ACL tears happen and how are they treated. Who does this affect? Now, this can affect the athlete, the coaches, and the athletic trainers, or anyone in the sports industry or sports medicine field. Now, how it affects the athletic trainers is they have to help the athlete find either prevention strategies, help them with rehab, or help them during the surgical time. Now, the coaches have to find a new way and find new ideas for the games. And then the athletes, it also affects them because they're the ones that have the ACL tear and they don't know if they can play again or not. Now, the sports industries, if it's a major athlete, if it's a pro athlete, say, they have to go by the contract, go over it, and see if they can play throughout the year or if they're done for the rest of the season. Who needs it to understand and why they happen? Athletic trainers, coaches, and athletes should all understand why this happens and how it can be treated. Helping them understand will maybe help get more prevention strategies going during practices or even during games. Helping people understand will maybe increase the risk of the tear or even understand how the athlete is feeling throughout the whole thing. Mentally, an athlete can go down and be drained because they're not playing a sport, or especially if they're at the college or pro level. Mentally, they don't know if they can play again or at least go to the pro level, or if they're a pro, they don't know if their career has ended. Causes: poor mechanics such as landing wrong and instability. In the picture where the girl's knees are bent, sometimes landing like that can cause a rupture. A direct blow to the knee is full contact that causes a rupture. So, if someone directly hits your knee, biomechanic factors like an angle of the landing, which exactly is that girl, constant stress to the knee or injury to the knee. Injuring the knee multiple times can cause stress and maybe cause a tear once everything has settled. Sudden stops. When suddenly stopping, sometimes it can hurt your knee, but sometimes it also can blow it out. Hormonal factors, which is more concerning for women. Hormonal factors can be caused in women because of their hips and the biomechanic factors. So with women, it's just they're more likely to tear their ACL just by the factors that women have. Types of tear and their treatment. A minor tear is where the ACL is not all the way torn, so it can be a partial tear. And with the partial tears, usually people will just get a knee brace like the one below, or an actual knee brace that only covers everything of the knee except the middle. So usually that can help. Also, they'll do some physical therapy and probably get the knee back to normal. Now, with a major tear, when it is completely torn, there is no ACL left usually. Sometimes in some cases there might be a little bit of ACL left, but usually there's not. With a minor tear, it can be treated with a brace or physical therapy. With a major tear, most people have to get surgery to repair it. If there's no ACL, usually doctors will use a cadaver ACL and replace it with put the new one where the old one should be. Usually if it's still there, they'll just pull ligaments from somewhere and put it back. Rehabilitation. If a person has a severe tear, they will need to do the surgical route. After surgeries, all surgical patients will have to do some type of rehab, and usually that's physical therapy. Physical therapy is the best option to get them back to full range of motion. Rehab is focused on getting back strength, having full range of motion back, and neuromuscular control. Without rehab, after surgery, people will not be able to go back to normal. Usually 2 days after surgery, they make you go to physical therapy right away. And from there, you will start slowly getting your range of motion back. And on the brace, on the sides, there's a little like switch where you can change the range of motion and how far you want it to go to and how far you want your knee to bend. And down below, there's some exercises that they usually make that some athletes or people do after or in physical therapy. Prevention. Neuromuscular training programs help prevent tears or it completely. This can help improve biomechanics and muscle control. Making sure people have the right shoes when they are working out or playing a sport can be major prevention. So in this picture, the way the girl's hip is, like I said before, with the causes in women, her hip is at an angle and it's not aligned with her leg. So with that, her running and when she lands or when she does a sudden stop, it can cause a rupture. Having these training programs to help prevent ACL injuries are a really good thing because then athletes and coaches can understand what do I need to do right and what am I doing wrong and what do I need to change to be right and make sure this doesn't happen. And here are some references.